Great. Okay, well, welcome. I don't see any other people, so I'm assuming there's people out there. This is Carol Simla, and this session is called the 220 Rule for Writing Readable Materials. And I'm very happy to be with you today and look forward to answering your questions. Somebody raised your hand, and well, I guess you guys are going to guide that from the behind the scenes. Is that right?
Instead of raising hands, if everyone would not mind typing a question in the Q&A, and that is the best way that we can monitor questions. Thank you.
Okay, so go, please. This is what we will cover today. What is the 220 rule? Why use it as opposed to other readability tools? And how do we apply the rule step by step? We'll go through some examples. We'll talk a little bit about plain language basics. And we're going to talk a little bit about everybody's favorite thing, legalese. Go. The 220 rule is kind of just a rule of thumb, and I love rules of thumb. I know that they're not comprehensive legal documents. They're just something that you can grasp onto in a pinch. So the 220 rule is one that sort of evolved for me over the years. The 2 is 2 syllables or less per word. So you basically speaking using or writing using 2-syllable words. Now, I was surprised to learn that not everybody knows what a syllable is or how to count how many syllables a word has. But when I was in school, what we did was we clapped. So, for example, the word clap has 1 syllable because you clap once. And if you say the word syllable, syllable. Okay, syllable has 3 syllables. So you basically clap each time you say a part of that word. That's how you count syllables. Okay, the 20 is 20 words or less per sentence. You count each word in the sentence, and if it's a hyphenated word, it counts as 1. If it's an abbreviation, it counts as 1 word. So that's what the 220 rule means. When I see 220 rule, I think 2 syllables, 20 words. 2 syllables, 20 words. And if you just kind of keep that little rule of thumb in mind as you're writing materials, it really helps to make your writing readable and at the 6th grade reading level. Go. Please. Why use the 220 rule? Well, because short sentences and simple words are easy to understand. And this is true even for people with PhDs, MDs, legal degrees. Everyone I have spoken to seems to understand short sentences and simple words. That is not true if you use legalese, obviously, or clinical language or any other kind of jargon. So the goal here is not to use medical jargon, legal jargon, or business jargon. Another way of thinking about it is it's the way you talk to people who don't understand. So if you're speaking to someone and you're going along in your little clip and they're giving you signs that they don't understand, wouldn't you stop and rephrase what you're saying? At least slow it down or maybe ask a few questions. One of my partners in the industry found that she did the best work when she had her daughter, an 8-year-old, read her materials that she was writing for medical clients, because the 8-year-old would pause and would ask questions, and that's how she knew where she needed to be more simple, clear. So just making things more accessible. Go, please. Why do I do this? Well, because of all of the confusion in healthcare. It's really important to understand what your medical conditions are, the best way to take care of yourself, what it is your doctor wants you to do and why. And this goes for both me and for my family members, because I've worked with family members with dementia and other various health problems, and they too need to understand their health condition and what it is they need to do to stay healthy. I have worked with diverse populations over the years, and so I've worked with international students, and I've worked abroad, and I know that not everybody understands business level English. And I think it's a little presumptuous to assume that if you live here, you will understand the English that I use. I prefer to think maybe I should make myself understandable to my audience. So that's what working with diverse populations has done for me. You need to find an easy way to talk to people and explain things. And nothing taught me that better than my own special needs child. She's in her 40s now, but ever since she was born, I found that she particularly needs to understand what it is how to take good care of herself. She lives semi-independently, but she needs to, she's very articulate and she reads, but at about a 6th grade reading level. So she taught me that everything can be said in plain language. And she's also very curious, so she doesn't let me off the hook with, well, it just is, or some other kind of, deflection. She wants to understand, and so I have learned that there are ways to explain everything. The other reason I do this is because I'm sort of a glutton for punishment. I have what Finns call sisu. And sisu is the ability to stick to it no matter what at ridiculous odds. It's just part of my Finnish background. So sorry, I just can't let go and say, well, never mind, I don't worry about it then. I have to see things through. And so this is one of the reasons why I work really hard in life to break things down into nice, easy, understandable, usable formulas. Go, please. So this is one of the things I hear a lot, and you're probably asking it right now. But you can't make everything plain, right? Wrong. Go, please. Anything that can be said in plain language. That's me. You can quote me on that. That's what I found. And I'm not just saying that as pie in the sky. I really sincerely mean that. You have to reframe, rephrase. Sometimes imagine, I think it helps a lot to kind of put yourself in the shoes of the person who's trying to understand you. Like, what is their perspective on it? And maybe reframe it and put it into other words. But anyway, regardless, no matter how much you question that it's true, it actually is true. Anything that can be said in plain language. It may take more language. It probably takes a lot more small words. One of the nice things about English, and believe me, I love English and I love big words, and there are many wonderful words that say a whole concept in one word. But those aren't the words that most people understand. So when you're working with our clientele, get used to using a lot of small words. Go, please. This is an example of how to apply the 220 rule. As you're looking at a text, You identify step one, identify the words with 3 or more syllables, or what we like to call long words. So 3 syllables, I know it doesn't seem like that's a really long word, but we're going to call 3-syllable words long words. And the truth is, of course, you can't always, or don't even need to always, eliminate 3-syllable words, but you know, there's probably some pretty good 2-syllable words that you could use. English is, you know, very rich in 1- and 2-syllable words. There are thousands of 1- and 2-syllable words in English. So it's not like you're dealing with a shortage of words here. There's plenty of other words. Once you've identified the 3-syllable or more words, then you identify sentences with more than 20 words. Sometimes we call those run-on sentences. I call them run-on sentences. So the next 2 steps are fairly obvious. You replace the long words with short words. And you shorten the sentences with more than 20 words. Shortening sentences is a fun exercise. I love it. I encourage you to do it for fun and pleasure. Just chop a sentence in half. Put in a period and start it anew, you know, take out the conjunctions and so on and just start a new sentence. It works many times to simplify and shorten sentences. Go, please. Okay, so step by step, let's take a look at a postgraduate reading level text. Go, please. Postgraduate meaning grade 18 in this case. So this is sample 1. So if you have this printed out, or maybe just sort of visually, you can circle the long words and underline the long sentences. So remember, a long word is word with more than 2 syllables, and a long sentence has more than 20 words. So I'll read through it slowly, and you can think about what are long words and what are long sentences in this 18th grade level text. Readability formulas are often used to guide the development and evaluation of literacy-sensitive written health information. However, readability formula results may vary considerably as a result of differences in software processing algorithms and how each formula is applied. These variations complicate interpretations of reading grade level estimates, particularly without a uniform guideline for applying and interpreting readability formulas. Okay, now if you're paying attention to content, it's describing a problem that exists a lot for those of us who read and evaluate materials for readability. But the text itself is not readable in the 6th grade reading level, and the goal here is the 6th grade reading level for plain language. Go, please. So in this text, these are the words with 3 or more syllables, and they're just sort of bolded here for you. Readability and formulas are more than 2 syllables. Development, evaluation, literacy sensitive, information. However, readability, formula, considerably. Differences, processing, algorithms, formula. Variations, complicate, interpretations, estimates, particularly uniform, applying, interpreting readability formulas. Those are what I would consider problematic words. So those are the words that need more attention. Go, please. All right, and if that same text, these are the sentences with more than 20 words. Though actually the one that's more than 20 words is the one in the middle, the 23-word sentence. However, readability formula results may vary considerably as a result of differences in software processing algorithms and how each formula is applied. Now, just looking at that sentence, of course, it's 2.5 lines long in this format, and it's got a couple of really complicated concepts included. So I would consider that a run-on sentence in terms of readability. It would be very easy to break that down into 2 or 3 sentences that give the meaning without using so much jargon. The other sentences are long but not bad. Go, please. So you want to replace those long words with short words. How would you do it? Let's go, please. So readability formulas is the first word that we identified that were long words. You could say reading level for readability. So now you have reading level, and then formulas could be tools. Reading level tools are often used to guide. Development could become making. Reading level tools are often used to guide the making. And evaluation is a 2-syllable quasi example of that would be rating. The making and rating of literacy sensitive, well, easy to read. And information I left as information. So going from readability formulas are often used to guide the development and evaluation of literacy sensitive written health information. We get to reading level tools are often used to guide the making and rating of easy to read written health information. And that could even be shortened further as I think about it, because if it's easy to read, then clearly it's written. So you wouldn't even need to use the word written health information. But that's just the way I think. As I read these things, I'm always kind of trying to streamline them down to smaller collections of words. Are there any questions or comments so far, folks? And hearing none, shall we go, please?
Actually, Carol, if you'll click the Q&A at the bottom, you will see a few questions that have appeared.
Oh, okay. Thank you.
And if you'd like, we can read them to you.
Oh, I can see them. Can you speak to your experience with applying this in populations with cognitive or speech impairments, such as those after a stroke or brain injury? Okay. Keith Seginda is going to answer this question live. Well, my experience is for the past 41 or 2 years in explaining things to my daughter with cognitive disabilities. But I've also cared for my mother and aunt with dementia, and you know, and I've worked with focus groups and advisory groups that include people with developmental disabilities, and I'm very used to talking to people like that. And so I guess for me, it's not so much, oh, this is a person with a cognitive disability, I'm going to speak differently. I try to speak in plain language all the time, actually. And when I get cues, I try to be very observant and look for cues in my audience for what they're not understanding. And I sort of automatically paraphrase and then ask them questions. Does that make sense? Any questions about that? And I try to get feedback, because I guess for me, the short answer is it's just easiest to assume that they don't understand long words. That's the way I think of it. Use short words until for some reason that doesn't work. This is, like I said, this is more a rule of thumb that really helps me in creating and evaluating materials for medical audiences. Okay, so Charlene says, are articles and conjunctions being considered in the word count? Yes. Every word is one word, and a hyphenated word is one word, and an abbreviation is one word. So yeah, I mean, you can develop other formulas if you like, but just for me, as a rule of thumb, that works fine. It's better to have, if you're counting the articles and conjunctions, yeah, your word count is going to go up. But you shouldn't be writing 22, 23 word sentences. That's my feeling. Just go ahead and let those count as words. You're trying to get to short sentences. Anonymous attendee said, I don't know if we're going to get feedback on that. With short sentences, how do we emphasize main points? Oh, good question. Will bolding increase readability? No, that's really not the point. I mean, sometimes maybe, but don't play around with fonts a lot. I personally prefer the fonts that are just plain and simple, with like the ones I've used in this presentation, without the little tails and curly cues. So for some reason the word is evading me right now, but anyway. Oh, the question disappeared, darn. Because I wanted to get to the first part of that question, which is, where was that last one? Can I have the last one back? I think it was anonymous, or is it gone? Because I think the best way to get across important points is using short sentences. Short sentences. That when you speak in short sentences, it kind of automatically emphasizes the content of the sentence. It's a little bit of a journalistic trick. When they start going to really short sentences, that's when they're trying to tell you to pay attention. This is where a thesaurus comes in handy to find word replacements. Yes, thesauri are very handy. I love thesauri. I love Google. Use whatever tools you can and find handy and reliable for yourself. Excuse me. Brenda Foster said, is there any software that can be used with other professions that need to revise their content to being at 6th grade reading level? I know many physicians that could benefit from learning how to do this, but it may simply be easier for them to use a software program. Well, that's the ongoing problem. Yeah, I mean, I understand there are writing tools that will tell you when you're writing in gobbledygook. That's what I call the technical word for bureaucratic language is gobbledygook. So yeah, I don't know what to tell you other than use whatever tools you can find, but I guess I have to do a little personal caveat here. I started off, I love higher education. I myself have a master's degree and I love going to school and I didn't ever want to stop. And I love big words and I didn't ever want to have to use anything else. I would get so excited when I find out that there's a word for something that takes 7 or 8 little words to say. What I found was that that's not helpful in explaining things to people, unless they're also at the graduate level. So, but what I have also noticed is that even postgraduates and physicians understand plain language. So the question is, do you want to be understood by an esoteric little group of erudites and so you can use all your big words? Or do you want to be understood by the whole population? If you want to be understood by the whole population, then you probably better park your really big words somewhere else for the time being and just use small words to say what you want to say. Megan says, what would you do with necessary long-term, such as diabetes? Okay, diabetes is a term that if you have it, you probably have heard it. Now, diabetes is 4 syllables, but it's a common 4 syllable. It's like information. You know, there's not a really good substitute for it. You could say sugar sickness, or I don't know. I mean, sometimes I go to other languages to see what they call it, because some languages are very descriptive of the condition. And so I think in German, I think it does come down to sugar sickness or something like that. Anyway, you know, sometimes you can get cues and helps. And if that's the case, then I always put those in parentheses with the long word. Parentheses are a helpful tool in that way. Tanya says, what is your opinion on the Flesch-Kincaid readability tool that is available in Microsoft Word? Any value in using it? Yes, I use it. Flesch-Kincaid is the one that I use the most, and that's the one that I have found in the literature has the most, I guess, reliability, credibility. You know, lots of people subscribe to it. I actually read the book that Flesch wrote about readability. This was like way back. I think it was in the 40s when he wrote this. And he has some really good solid bases for his theories. So I do subscribe to the Flesch-Kincaid tool. But, you know, to be honest, I don't think there's any one silver bullet. I don't think, you know, Microsoft Word, for example, what are you going to do with a PDF text? Well, for a PDF text, I've been using an online tool that I found that is also pretty good, reliable, and easy to use, and you can just paste in any kind of a text in it. And it was developed by a software developer called computer scientist named Sarah Tyler, and I found to be a very good usable tool over the years. But I've never found one tool that seems to answer everything. And what I have found works the best is to write your text readably to begin with. And that's why I advocate the 220 rule. If you want to avoid, you know, people criticize the Flesch-Kincaid people. Some people say that the SMOG report is much better. Well, that's fine, but the SMOG scale doesn't really evaluate all texts. So, you know, like I said, I don't think there's one silver bullet, but no matter what it is, what tool you use to evaluate, it's easiest to evaluate if you start by writing plain language to begin with. Anthony says, medical legal professionals fear that converting documents to their simplified version may compromise their contents. Excuse me. Yes, I know that. And boy, is that a run-on sentence, Anthony. But anyway, okay, I actually really love this question, because I raised, in addition to my daughter with developmental disabilities, I managed to raise a lawyer. And so she, of course, speaks legalese and understands legalese, and I have learned how to deal with lawyers. Lawyers understand the law. So what helps the most is if you have a company policy or law in your state, as we do in Oregon, and CMS has some guidances too around using plain language. You know, if you have a law that says you have to use plain language or write at the 6th grade reading level, lawyers understand that. So when the lawyers say, well, that's not the language in the law, the language in the law says blah, 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 blah. And I say, yeah, you're right. And the language in this law says you must explain this to our members in 6th grade reading level. Well, you know, they may try to argue that their law trumps my law or whatever, but I'm just a broken record. Readability is readability. And then sometimes I get into the explanation. No, it's really important for our clients to understand their medical conditions. And it's really important for our members to understand their rights. It's really important for our members to understand their benefits so they can appropriately access their benefits. So just kind of break it down for the lawyers, the same as you would for pretty much anybody, so they can understand it in their terms. Because what lawyers understand is the law. So you want to make sure that you can tie what you're telling them to the law, that they have to be written in plain language. That helps a great deal. Because, and what you're calling specificity, Anthony, it's gobbledygook. Now, as an attorney, you know, you'll say, oh yeah, that's completely specific. Now I understand exactly what you mean, because you know, it's in the gobbledygook. But other people won't understand it that way. In fact, they'll probably turn off the minute they see the first 3-4 syllable word. So you're not helping them understand. And the point of health literacy is to help people understand. Anonymous says, using familiar words or words highly used in the public are okay sometimes too, right? Absolutely right. Yes, use common language. That's one of my common refrains in this field is, that's not commonly used, you know, that's not commonly used English. Somebody says something, and you know, if they're a lawyer or a nurse or an ingrained bureaucrat, they'll argue, no, that's commonly used here. I hear it around here all the time. Yes, yes, in your field you hear those words. But outside of your field, people don't use those words. And you know, I'm sorry, I guess it's a little bit of tough love, but sometimes I think it helps to let people know if they're sort of in their own little niche and not seeing the bigger picture. Are there lists that offer suggestions for hard to simplify words? Or do I use a thesaurus? I use anything and everything. We developed our own Oregon list of readable terminology because we have some concepts like the prioritized list that we use in the Oregon Health Plan that maybe aren't necessarily used other places. So we have our own list of, and I developed it myself. I just took an Excel spreadsheet and put down Oregon terms and then came up with readable terms, basically using the 220 rule. You know, the 220 rule isn't the holy grail. I mean, there are problems with it. I'm not saying that. I'm just saying if you use it as a starting point, it will make creating plain language much easier. Aaron says, I find that the word information is often problematic and hard to replace with something simpler. Yeah, that's right. There's not really a good replacement for information. So I use information. You know, it's a 4-syllable word, information. It's, you know, sometimes depending on the context, there may be other ways to say it, but, and many times, and I think more people need to try this because I think sometimes people are afraid to. Try leaving a word out and see, is it really necessary? Sometimes long words don't really add a lot of meaning. They may just sort of add pomp and circumstance or something and give it a technical flair, but sometimes you just don't need those words. So try it, just try it out and see if you can just leave some of those words out. No. Brianna says, if you're working with a medical professional who is concerned that plain language is dumbing down or that their writing won't be taken this seriously if it's written in plain language, what do you say to them? Oh, that's easy. I love those conversations. I have those all the time. You know, doctor, it's important for your clients to understand what their condition is. Do you want your clients to understand, your patients to understand their condition? Do you want them to follow your instructions? And that's maybe dumbing down a little bit. But, I probably phrase it that way, but that's basically the conversation is. This is so that your patients will do the right thing. And won't be taken as seriously. No, people aren't going to take things seriously that they don't understand. That's the bottom line. Okay, I guess perhaps we should go back to the presentation because I'm using up all my time on the questions, which are fun. But let's see, how do we go back to the presentation now, Mario? I think we handled the one there. I could do these questions all day, but I think maybe we should go back to the slides.
Yeah. Carol, you can just cross out of your question and answer.
Oh, okay.
Yeah, and then just return to the PowerPoint.
Okay. Thank you. Thank you to my audience for being patient. Okay, so we handled this one. Go, please. Okay, so when we're looking at some of these other, okay, these variations, okay, this is a good example of something you don't really need. This. Just replace these variations with this and complicate, okay, muddles, interpretations, understanding, estimates, measures, particularly without. In this case, I chose because there is not, and it's a contextual thing. But so you go from that long sentence to this muddles understanding of reading grade level measures because there is not. So do you see the process? I hope this is becoming clear that if you can deal with it word by word and come up with better words, and then take that new sentence you've created and maybe adjust it a little bit for meaning. Go, please. A uniform guideline for applying and interpreting readability formulas. Uniform, exact in this context, applying, using, interpreting, understanding, readability, again, reading level, and formulas are tools. An exact guideline for using and understanding reading level tools. Now, again, like information, understanding is a long word, but it's not a word that's easily replaced. So I use the word understanding, but understanding is better than interpreting. I think it's a little more accessible. You might argue some of these fine points, and that's fine. If it's your text, you should write it the way it should be. But if you want to make it more accessible to more people, try using the words that are used in common speech. Go, please. So shorten sentences. What you want to do is you look at where they can be broken up without changing the meaning. Can any run-on sentences be made into bullets? Bullets are great. It's a wonderful tool to use. Remove passive voice and complex sentence structures. So for example, reading level tools are often used to guide the making and rating of easy to read written health information, 17 words. But reading level tool results may vary a lot as a result of different models and how each tool is applied. This muddles understanding of reading grade level measures because there is not an exact guideline for using and understanding reading level tools. Okay, so the last two sentences are still too long. Go, please. So you shorten them. Reading level tools are often used to guide the making and rating of easy to read written health information could become, reading level tools help us write and rate health information so that it's easy to read. Okay, so now, but reading level tool results could become just but results. May vary a lot because of, instead of as a result of. Now, as a result of is not bad, but you know, you can cut down the number of words just by using because. Results may vary a lot because of different models and how we use them instead of how each tool is applied. This muddles understanding of reading grade level measures because there is not an exact guideline for using and understanding reading level tools. Okay, so I rewrote that as this can be confusing. Confusing is still 3 syllables, but I don't think it's a bad long word. This can be confusing since there is no exact guide to using and understanding these tools. I think that says the same thing. I think the meaning is the same. I just think it's more accessible. Go please. The results, a better text. So reading level tools help us write and rate health information so that it is easy to read. But results may vary a lot because of different models and how we use them. This can be confusing since there's no exact guide to using and understanding these tools. And that's pretty much what we talked about a few moments ago with some of the questions. Yeah, it is confusing. There are a lot of, I think I read something on the message board that there are like 200 reading level tools online or something. Yeah, I mean, that can start to get confusing. That's why, again, getting back to our roots as a person, not just as a professional or a technician, I want to use plain language. So if I use plain language to begin with, I don't have to spend so much time rewriting myself. Go please. Okay, so these are those two paragraphs before and after the 220 rule. And I'm not going to reread them. I'm not going to reread the first one because it's just, I mean, I look at a paragraph like this and I just see gobbledygook. I mean, just even glancing over it, you see literacy sensitive and readability formula and software processing algorithms and things like that. To me, that's just screaming gobbledygook. After we get to grade 4, reading level tools help us write and rate health information so that it's easy to read. Okay, I think, there you go. I have a sentence that most people will understand. But results may vary a lot because of different models and how we use them. Yeah, okay, I see. There's some complications in how you write readably. This can be confusing since there's no exact guide to using and understanding these tools. And therein lies the problem. There is no exact guide. That's why I like the 220 rule. It gets me starting in the right place. Go please. So you want to, follow these basics. If you use the 220 rule, you will be following these basics. Go please. Get to the point. Write for your customers and their interests. So if you're writing for patients, and I work with the Oregon Health Plan, this is what the crux of our mission is. Their benefits, what to do, and their rights. Those are sort of some of the basics that we have to convey clearly and effectively to our members so that they are healthy. Basically, that's our mission, is to create healthy Oregonians. For caregivers, they need to know how to get the patient's needs met and the patient's rights. Providers need their patients to know the basics about their health care. Advocates want patients to know about their health needs, and community partners their point is that their patients can get their needs met. So think about that, what your perspective is. If you're a community partner, you don't necessarily want to write from the exact same perspective as a provider. Go please. What helps get to plain language? Laws mandating plain language at the 6th grade reading level. I think that's, put that on number 1 on your list if you're looking for things to do in 2020 or 2021. Focus groups, bring in a group of people, not people from your agency, but your target audience, your people who need healthcare. If you talk to people with early English skills, for example, recent immigrants, children have early English skills. If you speak to children in a way that they can understand, you're probably going to be using plain language. It's a really good measure. I'm not saying that as a put down, and I want to be very careful about that. I don't want people to think that they should talk to people like children. But People with early English skills need basic plain language. Best practices, and there's a number of ways to research and use those, and suitable material. You know, don't feel like every piece of gobbledygook in the world has to be written for people who have low literacy. And a good example of that is the CMS website. I love the CMS website. It's bookmarked, I go there often, but the information on the CMS website is not readable. And if you cut and paste things from the CMS website into your materials, you will be messing up your readability. And I've actually expressed that concern of mine to CMS, and I think they are aware of it. I think they're trying to get better at it, but it hasn't been a high level priority. Let's just put it that way. But you know, you can find suitable material lots of places. I have found the Arizona Health Department's website is helpful. That's where we got the idea for the language, creating our own thesaurus, our own list of equivalents in plain language. So some of the other states are doing really good work. Go, please. What measuring tool to use? This is a big question. I know there's probably a lot of controversy. Flesch Kincaid is the most common. It's for ratings above grade 6 reading level. Then you can apply the 220 rule. So that's where I usually start off. I use the Flesch Kincaid to see, well, where does this text fall in that scheme? If it's way above 6th grade, then yeah, start looking at, like we did in that past exercise. What are the long words? What are the long sentences? How do we deal with them? SMOG is a very highly approved rating system, and I think it's called a systematic measure of gobbledygook or something like that, which is a cute name. But anyway, at least one study, the University of Oklahoma's College of Pharmacy, said that it is the most consistent reading level tool. But any tool that you use will need additional input due to possible distortions. The fact that you need to maybe adjust meaning in a given circumstance. And I think with this audience, I don't need to be too concise about that. You know that there are lots of complicating factors in any text. Go, please. What causes distortions in readability scores? Hyperlinks, formatting, missing punctuation, acronyms, long numbers, including dates and IDs. And I don't know, there's others, I'm sure, but how can you avoid distortion? Well, one of the little tricks that we do, of course, is just to cut that problem out of the text and then measure it. You know, that's one way. I mean, it's a trick, but if you absolutely have to have that problematic piece of language in there, then maybe exclude it from your evaluation. It's a trick and it's not real honest, but if you feel like that's what you need to do, then do that. Don't give up on plain language just because there are some difficulties in your text. Try to work around them. You can avoid distortion by just plain using plain language. Go, please. What are the barriers? Well, nice to know versus need to know. Sometimes, you know, we have a sense that, oh, we've got to include all of this background information. And sometimes I think that's true, but sometimes it's not. And if there are things that we can address in another way, then try to find another way, you know, through parentheses. I'm not a big fan of footnotes, but maybe it's footnotes, parentheses, or little side box explanations. Status quo and inertia are big barriers to getting to writing at the 6th grade reading level. Now, people are unfamiliar with it. People got their degrees. They're very proud of their degrees, their postgraduate degrees, and they want to, you know, let everybody know that they've studied and got a really big vocabulary. That really is irrelevant when we're writing for people with low literacy. So try to, you know, belong to Mensa or whatever and use your big words. But for writing in it for our clients, let's use plain language. Lack of community input. I mean, unfortunately, too many people in our field don't ever really talk to people in the community or their clients. That's a problem. Indifference, ego, fear. The legal department, as I've already said, is a big barrier. But remember, the answer is they understand the law, so get a law that they have to obey for readability. Go, please. Go, please. Yeah, okay, this is an example of legalese. I don't want to go through it. Go, please. I think we all know legalese when we see it. Legal writing is used to communicate rights and responsibilities. But I've heard many times I've heard, well, the Justice Department won't let us say it that way. Is that really true? Or is that just sort of fogging the problem? Because I've sometimes gone to the legal department and said, no, wait a minute. Are you saying you don't want people on this plan to understand what their legal rights really are? No, that's not what the legal experts want. They want them to understand their rights. So they just may not understand why plain language is important. And that, you know, if that's the case, then you need to convey it. I want to give you a sense of there's hope, because my daughter, the lawyer, told me that one of the reasons she became a lawyer was because of watching me advocate for my special needs daughter. So, you know, you can set a good example for a lawyer. Other approvers may fear changing the language because it's always been this way. It's legally required. Legal told us it has to say this. Yeah, I've heard all of those. Again, sometimes you just have to get back to, well, the law says we have to write at the 6th grade reading level. If you have that law, you can be a very nice, pleasant, broken record and just remind them that the law says, yes, those are all of their rights, but you have to communicate them in a way that the people will understand and use them. Go, please. And I guess I'm wondering about time. How? Well, I think we're getting towards the end.
We have about 8 minutes, 7 minutes.
Okay. All right. So let's work together toward plain language. Edit legal writing for plain language. You know, you can work with your legal department on it. Say, you know what? We have a goal here. We want to communicate these concepts so that our audience will use the information. Will you work with us to help make sure that we keep their rights intact while we write so they can understand and use them? Have subject matter experts review documents for accuracy. Accuracy, of course, is extremely important. That's one of the main reasons why we review materials, is to make sure they're accurate. If experts fear changing the legal language, ask your legal department to review for accuracy. You can make them a partner of yours, and be sure to know and cite your federal, state, and local readability laws. Hopefully you have some. If you don't, I guess that would be number 1 on your to-do list. And we found that there are state readability laws in places we didn't necessarily know to begin with. So we went through some of the statutory language and various other places to find where the readability laws were lurking, and they're there. Go, please. Here's the federal law for Medicaid member materials, 42 CFR 438.10C. This is where I live and breathe. Each state enrollment broker, etc., entity must provide all required information in this section to enrollees and potential enrollees in a manner and format that may be easily understood and is easily accessible by such enrollees and potential enrollees. Emphasis added. So there you go. You have to communicate this so they can understand it. It's pretty basic and understandable, but but still controversial sometimes. Go, please. Okay, so resources, plainlanguage.gov. And there's some resources there, checklist for plain language and on the web. And I mean, this, in the past when I've done web searches, I've found incredible resources. Do any kind of research you want, you know, put your state library on the task. There are amazing resources out there. I'm not here to really review all of the resources because this is about starting with readability to begin with. Okay, I guess we'll do some more Q&A because there's probably some questions piled up. In other languages such as Spanish, the composition of sentences and words are per se longer than in English. I don't talk about how to make Spanish readable. I have a basic tourist level understanding of Spanish, and so if I see a text, I can tell whether I understand it or not. And what I've been told by many of our clients who are native Spanish speakers is that some of the materials we send out are written at a college professor level. So that's not right. They should be written at conversational Spanish level, just like English materials should be written at a conversational English reading level. Anonymous says, with short sentences, how do we emphasize main points? Oh, well, that's easy. 1 point per sentence. Oh, we already answered that, I think. Bolding, I don't understand. I don't like playing with formats and bolding and fonts. In fact, what I meant to say earlier was I like sans serif fonts. So just plain fonts without the little curly cues and so on. From a design perspective, would a better strategy be using coloring or bolding? I like coloring, but you have to be careful about color blindness. So, and also photocopying. So in the state of Oregon, we don't have a lot of options to use color printing. So I pretty much learned to use just black and white. But if you have the resources and ability to use color, do. But make sure you're using colors where there's plenty of contrast and aren't creating color blindness problems.
Carol, we're down to 2 minutes. If you want to, we'll put your contact information slide up.
Okay.
And maybe if there are any other slides you'd like to review, otherwise.
Yeah, we have 2 more slides. Can we do the last 2?
Absolutely.
I'm sorry. I don't know how I messed that up. Okay, so 1 more. Go please. Oh, okay, this is another example. This was right off the CMS website. It's an example of, I thought it was pretty cute because they wrote this paragraph to say we want input on how people are able to understand our materials. Go please. And going through all of those steps we did before, we can look and dissect and come up with all kinds of reasons why the wording isn't good, but go please. But when we get down to the bottom of it, here's a better way of saying that entire paragraph. It's in the after. We want to hear from you. Help us improve our service to you. Attend an open door forum near you. And for information about upcoming visits, visit, and then there's the link. So you see, you don't have to, even the way we name things like the Open Door Initiative, that's not an easily accessible language title. And I think the way we name our programs is important. So anyway, I like the way they put it in the second one, attend an open door forum, rather than the Open Door Initiative, blah, blah, blah. And to their great credit, CMS came up with this rewording on their own. So CMS, congratulations. That's the way you should write your materials in the after. Go please. Okay. Thank you so much for your attention. I hope this was helpful. I look forward to answering your questions, and I hope to answer them all. Will I be able to do that, or how can I address their questions?
If participants would like to use the discussion tab in your session online, you can take all of your Q&A there. Thank you.
Okay, thank you.